Hello students, subscribe the Fundamental Pharmacy and press the bell icon for more videos.
Hello students, join our online course for GPAT Niper Drug Inspector to get assured amazing rank.
Hello my dear students, welcome back to the Fundamental Pharmacy. Today we are going to see another classification, that is a classification number 33, anti-malarial drugs or drug treatment of malaria. Now this classification is very important for your GPAT Niper Drug Inspector and Government Pharmacist exam. So I would like to request you, please watch this video until end. My dear students, we have already seen 32 classification videos. If anybody has not seen previous classification videos, please go in the channel's playlist and watch all the classification videos because they are very important for your upcoming GPAT Niper DI Pharmacist exam. And believe me, a lot of MCQs they are going to be covered just by watching these classification videos, because I have not only explained you the classification but also I have told you other important points which are very important for these exams. So please go and watch all the videos from the channel's playlist. My dear students, before starting actual classification of you should know some background points, you should know some important points regarding the malaria. So first of all, what do you mean by malaria? So malaria is nothing but the kind of infectious disease. It is caused by parasite known as a malarial parasite. Now that parasite is present in the mosquito. Mosquito is known as a vector. Particularly, malaria is caused by the bite of female Anopheles mosquito. Who is the causative organism for malaria? So there are four organisms, or there are four parasites. They are known as a causative organism for malaria. First one is nothing but the Plasmodium falciparum. Plasmodium falciparum. Second one is nothing but the Plasmodium vivax. Third one is nothing but the Plasmodium ovale. Fourth one is nothing but the Plasmodium malariae. So these are the four Plasmodium species that can cause malaria. So first species is known as a Plasmodium falciparum. Now Plasmodium falciparum causes the most severe form of malaria. Most dangerous form of malaria is caused by Plasmodium falciparum. After that, Plasmodium vivax is there, Plasmodium ovale is there, and Plasmodium malariae is there. First two parasites, they causes severe type of malaria. So out of that also Plasmodium falciparum causes the dangerous malaria. Now how there is a development of malaria in the humans? What is the malarial life cycle? So we'll try to understand that life cycle of malaria. So whenever you will get, so what happens in the, as I told you, these parasites, it is a parasitic disease caused by various species of Plasmodium. Now that parasites are present in the salivary glands of this mosquito known as a female Anopheles mosquito. So these parasites, they are present in the form of sporozoites, okay, in the salivary glands of mosquito. Now when mosquito will bite to the humans, it will inject around 3000 of sporozoites in the humans. Now these sporozoites, they will get entry into the blood, and in the blood it will remain for 30 minutes. Depending upon the incubation period of individual species, they will start dividing. So from the blood, these sporozoites, they will get entry into the liver, and in the liver they are known as a merozoites. This stage is known as a pre-erythrocytic stage or pre-erythrocytic schizogeny. Pre-erythrocytic stage or pre-erythrocytic schizogeny. Once these sporozoites, they get entry into the liver, they are known as a merozoites. Now these merozoites, they have two choice depending upon the species. So if the malarial parasite is, for example, Plasmodium falciparum, what will happen? Plasmodium falciparum, it will directly start dividation or multiplication in the liver cell. So particularly these sporozoites affect the reticuloendothelial cells of liver. They multiplies over there, and after the multiplication they destroy the cell, and there is a release of thousands of merozoites in the circulation. That is the one way. Particularly Plasmodium falciparum, the merozoites will divide and redivide in the liver cells, and after destruction of liver cell, the release of thousands of merocytes will be there. Yes, these merocytes will enter into the blood. Okay. Now, if the parasite is of your Plasmodium vivax or Plasmodium ovale or Plasmodium malaria, what will happen? Sporocytes or fumarocytes, they goes into a dormant condition. So if conditions are not favorable to them, they undergo dormant condition. They get hypnotized themselves, or they are sleeping, or they are dormant position. They get entry into dormant position. Now, Plasmodium vivax, Plasmodium ovale, Plasmodium malaria. Some of the merocytes they get dormant, they get sleeping, or they are known as a hypnozoites. They are known as a hypnozoites. Okay, and the stage is known as a exoerythrocytic stage or exoerythrocytic schizogeny. And remember, Plasmodium falciparum will not have this exoerythrocytic stage. Plasmodium falciparum will not have this exoerythrocytic stage, and that's why in case of Plasmodium falciparum malaria, relapse cannot occur, because these dormant merocytes, when conditions are favorable, they will divide and redivide again, and they can cause a relapse of disease. So that's why in case of Plasmodium falciparum, relapse is not there, but in case of Plasmodium malaria, Plasmodium ovale, Plasmodium vivax, particularly Plasmodium vivax, there is a relapse of disease because of these parasites. They undergo exoerythrocytic schizogeny, right? Now, whatever merocytes they are released in the blood from the liver, so they get entry into the RBCs. RBC means erythrocytes. So they will get entry into the RBC, and they will infect RBC. They will invade the RBC, and in the RBC, their stage is known as the erythrocytic stage. When these merozoites from the liver, they will get entry into the RBC, known as the erythrocytic stage. Now, in the RBC, they will multiply again. So they are known as the tropocytes. So in the RBC, these tropocytes will be multiply. They will divide and redivide. Okay, and after the maturation, they will get released from the RBCs. So RBC will be destructed. RBC will be bursted. So because of the periodic release, so every 4 hours there is a release of these merocytes into the circulation. Now these merocytes release causes the release of certain chemicals which causes the chills, fevers, rigors. Okay, every 4 hours. That is one of the symptom of your malaria. Now in the RBC, these merocytes they differentiate into two types of cell. First is known as the macrogametes. Macro means large cells. They will be differentiated into macrogametes and microgametes. So macro means small. So the two types of cell will be there: large cell and one small cell. So large cells they are known as the macrogametes, and they are also known as the male gametes. And small size cell they are known as the microgametes, and they are also known as the female gametes. So male gametes they are known as the macrogametes, and female gametes they are known as the microgametes. Okay. Now whenever another mosquito will bite you, and mosquito will suck a blood from your body. So at that time these gametes will get entered into the GIT of mosquito. Now there will be fertilization of these female and male gametes. There is a formation of zygote, and after that there is a ookinete formation. After that there is a oocyte formation, and finally you will get a sporozoites. Now these sporozoites they are present in the GIT of mosquito. They are present in the saliva of mosquito. When next time this infected mosquito will bite another normal person, so he will again release the thousands of merocytes in the circulation. Now there are two stages of this malarial parasite. First stage is known as a sexual cycle, and second stage is known as a asexual cycle. Now whatever sequence of events about this malarial parasite that occurs in the mosquito, so that is known as a sexual cycle of malarial parasite. So sequence of event that occurs in the mosquito, that is known as a sexual cycle, and whatever sequence of events or whatever cycle that occurs in the humans, it is known as a asexual cycle. It is known as a asexual cycle, right? So remember, so asexual cycle of malaria that occurs in the humans, and sexual cycle of malaria that occurs in the mosquito, right? So sexual cycle occurs in the mosquito, asexual cycle occurs in the humans. Remember, there are four causative organisms: Plasmodium falciparum, which causes the dangerous type of malaria; Plasmodium vivax, Plasmodium ovale, and Plasmodium malaria. Okay. So Plasmodium malaria and Plasmodium ovale caused malaria. They can be easily recovered. Okay. They are not a dangerous type of malaria, but every malaria requires treatment. Right. Now we are going to see, as I told you, this female mosquito will release the sporozoites in the circulation. These sporozoites will invade your liver cell, reticuloendothelial cells of liver, and it will undergo pre-erythrocytic schizogeny or pre-erythrocytic stage. So where there is a multiplication of these merozoites, there is a multiplication of these merozoites, and these merozoites will be released into systemic circulation. Now, if the malarial parasite is of Plasmodium vivax, Plasmodium malariae, Plasmodium ovale. So some of these merozoites, they will go into a dormant condition, and when the condition will be favorable, again they will multiply themselves and there will be release of, okay, these hypnozoites. So when merozoites will go into the dormant position or dormant condition, they are known as hypnozoites, and when condition will become favorable, they will be again multiple dividation, they will be released. So that's why malaria caused by a Plasmodium vivax, it causes the relapse of disease, but malaria caused by a Plasmodium falciparum will not cause the relapse of disease. Now when these merozoites will be in a blood, so they will infect the RBC blood cells, right? So when these merozoites or sporozoites are in a liver, they are known as a tissue schizones, and drugs which kills these tissue schizones, they are known as a tissue schizonticides. Now when these merozoites, they will invade your RBC, they will multiply in the RBC, okay, they will multiply in the RBC, and they will be released by bursting the RBC cell or by breaking the RBC cell, and this release causes the fever, chills, and rigors, because this release is related with the release of few chemicals also. Okay, now this cycle continues. Okay, so every 4 hours there is a burst of release of these merozoites in the circulation that causes the rigors, chills, fevers, and chills, fever, rigor, and other symptoms of malaria. Now in the RBC, these merozoites, they are of two types. So small cell and large cell. So these cells are differentiated into large and small cells. So large cells, they are known as a macrogametes. Large cells, they are known as a macrogametes, and they are known as a male gametes. Macrogametes, they are known as a male gamete, and small cells, they are known as a microgamete, and they are known as a female gamete. So they will be entered, they will get entry into the mosquito upon subsequent bite. Okay, and that is known as a gametocytes. Now drugs which destroy the sporozoites, merozoites present in the liver, they are known as a tissue schizonticides. Those drugs which kills the merozoites present in the blood, known as a tissue schizonticides, and those drugs which kills the gametocytes, known as a gametocidal, known as a gametocidal. Now you can see this again once. When mosquito will release is sporozoites in the blood, sporozoites will get into the liver, and that is known as a pre-erythrocytic cycle or schizogeny, right? So they will divide over there in the liver, reticuloendothelial cells of liver, and more merozoites will be released in the circulation. Okay, more merozoites will be released in the circulation after the multiplication of merozoites. Few merozoites may get into dormant position, and that is known as exoerythrocytic schizogeny. Okay, it is not with the Plasmodium falciparum, and that's why relapse cannot be occur. Now those drugs which kills this merozoites in the liver, known as a tissue schizonticides. Example is a primaquine, provanil, and tetracyclines. So only drug active against the exoerythrocytic schizogeny. Only drug active against the exoerythrocytic cell journey is a primaquine. So only drug which is active in the exoerythrocytic cell journey of malaria known as a primaquine. Now release the merozoites in the blood, they will infect the RBC and they will cause rupturing of RBC, leads to chills, fever and rigors. Now in the RBC, these merozoites will be differentiated into two types of cell, macro and micro. So male and female gamete respectively. Now certain drugs like primaquine, chloroquine and quinine, they affect or they kills these gametes, RBC. So they are the gametocidal. They are known as gametocidal. Now there are certain drugs which affect the erythrocytic cell, means they kills the sporozoites before getting entry into the liver. So what are the drugs? Chloroquine, mefloquine, quinine, then halophantine, artemisinin, mepacrane, atovaquone, sulfadoxine and pyrimethamine, proguanyl tetracycline. So these drugs, they are known as a true prophylactics. They are used for the prevention of malaria. True prophylactics kills the sporozoites, merozoites in both pre-erythrocytic as well as exoerythrocytic cytogeny. They are known as a radical curative. They are known as a radical curative. And drugs which kills the gametes in the blood, they are known as a primary tissue scissions. Now we'll see the classification again. Anti-malarial drugs, they are classified into different types. Anti-malarial drug, they are classified into different types of classes. So देखो, first is nothing but the cinchona alkaloid. So first class is nothing but the cinchona alkaloid. So natural alkaloids obtained from Cinchona gerardiana, Cinchona calice, Cinchona gerardiana, Cinchona calice. So quinine and quinidine, they are the Cinchona alkaloids, right? Natural alkaloid. Now semi-synthetic derivative of cinchona. So first one is nothing but the 4-aminoquinoline derivative. 4-aminoquinoline derivative. Question आता है इसके ऊपर, one of the following is not a 4-aminoquinoline derivative or one of the following is a 8-aminoquinoline derivative. So remember chloroquine, amodiaquine and piperacin. CAP मतलब टोपी जो टोपी पहनते हो ना आप धूप काले में. So cap. C for chloroquine, A for amodiaquine and P for piperacin. So cap is nothing but the 4-aminoquinoline derivative, right? Third class is nothing but the 8-aminoquinoline derivative. So what are the example of 8-aminoquinoline derivative? Remember primaquine is there, tefnoquine is there and buloquine is there. Primaquine, tefnoquine and buloquine. Okay. Antimalarial drug first class cinchona alkaloid, second class 4-aminoquinoline derivative, third class 8-aminoquinoline derivative, right? Fourth class is nothing but the quinoline methanol. In that we have mefloquine. Okay, mefloquine. It is mostly used in the malaria which is resistant to the chloroquine. Mefloquine is used in the treatment of chloroquine resistant malaria, right? Fifth class is nothing but the biguanides. So in that you have proguanyl. So remember this proguanyl is nothing but the prodrug. Proguanyl क्या है? It is a prodrug and it is converted into one active metabolite known as a cycloguanyl. Proguanyl is converted into cycloguanyl active metabolite. Now next class is nothing but that is the sixth class. Sixth class is nothing but the diaminopyrimidine derivative. Diaminopyrimidine derivative is nothing but the pyrimethamine. So pyrimethamine is nothing but the dihydrofolate reductase inhibitor. तो ये क्या करेंगे? It will prevent the formation of folic acid. So it is a dihydrofolate reductase inhibitor, pyrimethamine, right? Now seventh class is nothing but the sulfonamides, sulfa drugs. Okay? So in that you have sulfadoxine, sulfamethoxypyrazine and dapsone. So what will they do? They will prevent the synthesis of folic acid by inhibiting the folate synthetase enzyme. Okay? All these sulfa drugs, they are oxidant in nature. Okay? Then 8-aminoquinoline, for example primaquine, it is also oxidant in nature. So when they are used in the patient who is deficient with the glucose 6-phosphate dehydrogenase, so there is a hemolysis, right? Now next class, ninth class is nothing but the anti-malarial antibiotics. In that you have doxycycline and clindamycin. Doxycycline and clindamycin. So it is effective in the pre-erythrocytic stage, doxycycline, right? Now next class is nothing but the sesquiterpene lactone. So sesquiterpene lactone. So in that you have all the derivatives of artemisinin. So artemisinin, artesunate, artemether, artether, artelone, arterolane. So artesunate or artemethin, artemisinin, artesunate, artemether, artether, and arterolane. Arterolane. So all these are the derivative of artemisinin. What is artemisinin? Artemisinin is a sesquiterpene obtained from Artemisia annua, which is a Chinese herb. Okay. Now you can remember this is arte. So all sesquiterpene lactones, they are nothing but the arte. So artesunate, artemisinin, artemether, arterolane. Now next class in the antimalarial is nothing but the amino alcohols. So in that you have halopentrin and lumipentrin. इसमें हेलोपेंट्रिन एंड लुमेपेंट्रिन है. सो दीज टू ड्रग्स आर डेवलप्ड बाय चाइना. तो ये चाइना ने डेवलप किए. आउट ऑफ दैट हेलोपेंट्रिन, लुमेपेंट्रिन, सो दे हैव potential cardiac adverse effect. They have potential cardiac adverse effect. Now another class is nothing but the naphthoquinone. So in that you have atovaquone. Naphtha मतलब two rings, two benzene ring and ketone group. So naphthoquinone, atovaquone. So what is the mechanism of action of this atovaquone? It will inhibit the electron transport in the parasitic membrane. So that leads to damage to the parasite and parasite will die. So electron transport inhibitor. Now what is the mechanism of this sesquiterpene lactone? So artemisinin, artesunate or artemether, all these drugs, they binds with the hemoglobin. They binds with the hemoglobin and release the free radical, which damages the parasitic membrane, and that causes the death of parasite. So known as a sesquiterpene lactone. Now new drug is also there, known as a naphtharidine derivative. Naphtharidine derivative. So pyronidine. Pyronaridine is a naphtharidine derivative. Remember naphtharidine derivative, pyronaridine. So we'll see the classification of chloroquine in upcoming slides. Don't worry. Again you can see the classification. So first one is nothing but the cinchona-alkaloids. In that you have quinidine and quinine. Obviously ये quinine, quinidine, इनका adverse effect आपको मालूम होना चाहिए. So they will cause synchronism, black water fever. Quinidine is a cardiac depressant, so it can cause arrhythmia, etc., etc. Then quinine can cause photosensitivity reaction, allergic reaction. Then next class is nothing but the quinoline derivative. So in that you have 4 aminoquinoline derivative, 8 aminoquinoline derivative, and quinoline methanol derivative. So 4 aminoquinoline derivative, in that you have chloroquine, amodiaquine, hydroxychloroquine, and pyronaridine. Chloroquine, amodiaquine, hydroxyquinoline, and pyronaridine. In the 8 aminoquinoline you have primaquine, tefloquine, and बुलाक्विन. So these are the 8 aminoquinoline. इसके ऊपर क्वेश्चन आ चुके हैं भाई. 8 aminoquinoline डेरिवेटिव के ऊपर क्वेश्चन आ चुका है जीपैट में. So primaquine is 8 aminoquinoline derivative. primaquine के ऊपर कम से कम 2-3 बार क्वेश्चन आ चुका है. So primaquine is 8 aminoquinoline derivative and it is an oxidant drug. It can cause hemolytic anemia in the patient who is deficient with the glucose 6-phosphate dehydrogenase. क्वेश्चन आ चुका है. Chloroquine is a drug of choice. Malaria in the pregnancy. Chloroquine is a drug of choice in the malaria in the pregnancy. Okay. Hydroxychloroquine is also used in the prophylaxis of your malaria as well as prophylaxis of SARS-CoV-2. It is also used in the prophylaxis of coronavirus. Hydroxychloroquine. Quinoline methanol. In that you have mefloquine, lumipentrin, and halopentrin. So mefloquine is a drug used in the chloroquine resistance multi-drug resistance malaria. Mefloquine is used in the multi-drug resistance malaria, right? Now anti-folate drugs. So in that bigonides you have progonil, which is a prodrug. It is converted into cyclogonil. Right? Remember. Now diamonopyrimidines, in that you have pyrimethamine. So it is a dihydrofolate reductase inhibitor. Now sulfonamides, in that you have cotrimazole, sulfadoxine, right? Now remember this pyrimethamine and sulfadoxine. Pyrimethamine and sulfa drugs, they are combined together to have a synergistic effect. Pyrimethamine and sulfonamides, they are combined together to have a synergistic effect. Remember. Now next one is the artemisinin compound. So in that you have cis-terpene lactones like artesunate, artether, artemether. They are often from Artemisia annua. Amino alcohols, next plus amino alcohol. In that you have halofentrin and lumefantrine. Antimalarial antibiotics like doxycycline, clindamycin, atopapone. Now we will see this we have seen the chemical classification. We have seen chemical classification. Now we will see the therapeutic classification. So clinical classification or therapeutic classification. So first class is nothing but the true casual prophylactics. True casual prophylactics. So they will prevent the malarial disease. How? These drugs will destroy sporozoites before invasion to the host reticuloendothelial cells. So these drugs will destroy the sporozoites before the entry of sporozoites into the liver. Actually, no kind of such a drug is available for this type. No true casual prophylactic drug is available. Now casual prophylactics. So these drugs, they will prevent the maturation and they will destroy the sporozoites within the infected hepatic cells. So casual prophylactics means they will destroy the sporozoites in the liver and they will prevent their invasion into the erythrocytes or RBC. Examples of these drugs. Example is primapine, pyrimethamine and proguanil. Now these drugs, they are known as the primary tissue seizons. Primary tissue seizonicides or primary tissue seizons. So drugs which act on a pre-erythrocytic stage, they are known as a tissue seizons. Examples are nothing but the primapine, pyrimethamine and proguanil. Right? Now suppressive drugs. So these drugs, they are suppressive drugs. These are drugs, they will inhibit the erythrocytic seizogeny and prevent the RBC from rupturing. Example is nothing but the 4-aminoquinolines, quinine, artemisinin, pyrimethamine, tetracyclines and proguanil. Okay, so relapse can occur with the Plasmodium vivax. So Plasmodium vivax जो parasites होता है, malarial parasite Plasmodium vivax, that can go into a dormant stage, and that's why they can have hypnozoites. And when there is a favorable condition, it will grow again. So Plasmodium vivax relapse can occur with the Plasmodium vivax. Now radical curatives. Radical curatives means these drugs will destroy merozoites in the pre-erythrocytic stage as well as exoerythrocytic stage. So drugs which destroy the gametes or the drug which destroys the sporozoites in both pre-erythrocytic stage and erythrocytic stage, they are known as a radical curative. For example, it is done alone with the primapine in case of Plasmodium falciparum, and in case of Plasmodium vivax, primapine, proguanil, these are the radical curative. Now gametocytocidal. So these drugs, they will destroy the gametes, male and female. These drugs, they will destroy the gametes, male and female gametes. So example, suppressive drug like chloropine, quinine, artesunate, primapine, these are effective against the gametocytes. Primapine is highly effective against the gametocytes of all species. Remember, only primapine is a drug which is active in a exoerythrocytic stage. We will see the mechanism of action of chloroquine, quinine and meproquine. So what happens? Malarial parasite, they get entry into your RBC and they digest hemoglobin. Malarial parasite digest hemoglobin of your RBC and utilize that hemoglobin for the synthesis of amino acids, for the synthesis of one pigment of membrane. There is one pigment known as hemoglobin which is synthesized from hemoglobin, which is the important component of membrane of your parasites. So malarial parasite digests hemoglobin and releases the heme. So heme is nothing but the toxic compound to the malarial parasite. So that's why this heme is converted into hemazoin by the parasitic enzyme known as a heme parasite in the malarial parasite there is one enzyme known as a heme which convert toxic heme into hemazoin. So hemazoin is nothing but the non-toxic compound and it is a component of parasite membrane. So hemazoin is a very important component. It is a pigment of parasitic membrane. All these chloroquine, quinine, mefloquine, so these drugs what they do, they inhibit this enzyme, heme polymerase enzyme. Due to inhibition of this enzyme, heme polymerase enzyme from the by the chloroquine, quinine and mefloquine, so there is an accumulation of toxic compound. There is an accumulation of this heme in the parasites, and that's why parasite will die. So all these drugs, chloroquine, quinine and mefloquine, so they inhibit this heme polymerase enzyme from the parasite, and that's why there is a accumulation or there is a more amount of this heme which is a toxic compound to the parasite. There is a collection of this compound and that results in the death of parasite. So that's how chloroquine, quinine and mefloquine they will act. So that is the mechanism of action of this drug. So again very important question आ चुका है. So chloroquine is a inhibitor of heme polymerase in the malarial parasite. So it will prevent the conversion of toxic heme into non-toxic hemazoin, and that leads to accumulation which is a toxic compound to the malarial parasite. Now you can see they are known as a folate antagonist. So normally para-aminobenzoic acid is utilized by parasite and it is converted into dihydrofolic acid with the enzyme folic acid synthase, and dihydrofolic acid is converted into tetrahydrofolic acid by the enzyme dihydrofolate reductase. So both these folic acid synthase enzyme and dihydrofolate reductase enzymes they are present in the parasites. Okay, now sulfonamides they will block the conversion of PABA to the dihydrofolic acid. So sulfonamides they inhibit this enzyme folic acid synthase, and pyrimethamine inhibit the dihydrofolate reductase. So there is a sequential block of synthesis of folic acid in the parasite that leads to their death, because this tetrahydrofolic acid is very important component which is required for one carbon atom transfer reaction in the parasite. So these are nothing but the, remember pyrimethamine is a dihydrofolate reductase inhibitor, and sulfonamides are nothing but the folate synthetase inhibitor. Pyrimethamine is a dihydrofolate reductase inhibitor, right? Now we'll see some important points from this malaria or anti-malaria drugs. Important points from anti-malaria drug. So pre-erythrocytic stage. Pre-erythrocytic stage means when sporocytes will appear in your blood. So that is a cause of malaria. When there is entry of sporocytes from the mosquito to your body, that is a cause of malaria. And when exoerythrocytic stage will start, that is responsible for the symptoms of your malaria. So when there is a release of sporozoid or merozoites from the blood RBC, it leads to chills, it leads to fever, chills and rigor, right? Plasmodium falciparum will not undergo exoerythrocytic stage. Plasmodium falciparum will not have exoerythrocytic stage, will not go into a dormant stage. That's why a relapse cannot occur. But in case of Plasmodium vivax and other Plasmodium malariae, relapse can occur, right? Long-term use of chloroquine. What is the adverse effect of chloroquine? We have seen the mechanism of chloroquine. What is the adverse effect? So other adverse effect will be same, nausea, vomiting, then epigastric distress, bitter taste in the mouth, synchronism. Beyond that, if you use chloroquine for long term, so it will bind to your retina, retinal cells, retinocytes, and it will cause retinal damage. It will cause retinal damage or retinal pigmentation that is caused by chloroquine upon long term use. So it can cause bull's eye maculopathy. Bull's eye maculopathy. Remember, chloroquine has the largest volume of distribution. Chloroquine has the largest volume of distribution and is the drug of choice in the malaria in pregnancy. Then we'll next point. Now primapine, sulfonamides, these are nothing but the oxidant drug. Primapine, sulfonilamides, these are nothing but the oxidant drug and they are contraindicated in the patient who is deficient in the glucose 6 phosphate dehydrogenase. If there is deficiency of this enzyme, these drugs they act as an oxidant and they can cause hemolysis in that patient. Next point is atovaquone blocks the electron transport in the membrane of parasite, and that's how it is. Artemisinin is a fastest acting anti-malarial drug. Artemisinin is a fastest acting anti-malarial drug. It is a prodrug and converted into one active metabolite known as dihydroartemisinin. Now it acts by binding with the hemoglobin and generate a highly reactive free radical which damages the parasitic membrane. Now proconil is again a prodrug. It is converted to cycloconil. So I have covered a lot of MCQs. So a lot of probable MCQs I have tried to cover in a very short video. So and please subscribe the channel if you are not subscribed. You can order this magic bullet for GPAT Niper Drug Inspector Pharmacist exam preparation. Read 2-3 times and qualify 100%. It's my guarantee. You can WhatsApp me on this number. You can see we have very much promising results. Thousands of students they have placed in the Niper. You can also join our GPAT Niper 2024-25 online crash course. In that you will have live lectures, recorded lectures, study material, online test series also will be available. Study material will be available in the form of hard copy at your doorstep. All the lectures will be subject wise and chapter wise, and everything is included in the 8,000 rupees only. And if you get early in rank less than 20 in the GPAT exam, your fees will be returned to you.
Hello students, order the magic bullet for GPAT Niper Drug Inspector. Read twice and qualify 100% with